Good afternoon. My name is Dr. Alan Ettinger, and I am an adult epileptologist. I have the pleasure of being the first speaker in an educational event for neurological surgery, PC.
Epilepsy is a complex disease that requires a team to take care of you. In general, our philosophy is to, one, obviously to do no harm, two, to really use the most cutting-edge techniques available to do what we can, and to always be, thinking about what may be on the horizon.
My name is Gad Klein. I'm a neuropsychologist. I work with NSPC. The clinical neuropsychologist in general epilepsy that can help determine the nature and cause of the cognitive dysfunction in the patients with epilepsy. Is it from the epilepsy? Is it from mood? Is it from something else? And appropriate interventions can then be planned.
We're always adjusting our techniques to be, safer and to use more advanced techniques. We use, at times we might think about using radiosurgery, which is gamma knife or cyber knife, use the microscope when necessary, lasers when necessary, to aid in the safest and most minimal resection, so to do as little to get as much as possible.
We can't just say we'll tolerate some seizures. We need to be very aggressive about trying to knock out these seizures.
Now, depending on the type of epilepsy you have, the place where the epilepsy is coming from, the age at which you got epilepsy, and various other factors, you can have certain cognitive issues, cognitive deficits, cognitive weaknesses. Sometimes they may be mild, sometimes they may be more severe.
We've realized over the years there are just so many potential complications to seizures, and that allowing seizures just to go on isn't just allowing something that's a bit of a nuisance.
Again, the final role of the neuropsychologist in the surgical workup is to do the functional MRI, is to do the WADA testing to make sure that that cognitive function in your brain is mapped out as carefully and as delicately as possible, so that if Dr. Ettinger and Dr. Snyder and the rest of the team determine that surgery is appropriate, that there is limited to almost no post-operative issues and post-operative deficits, or if we think that there may be, we can tell you almost very, very closely what we expect to occur, and you can balance that against the risks and the benefits, obviously, of doing the surgery to help cure or to help minimize the seizures that you have. So that's the role of the neuropsychologist, and obviously I integrate my findings and everything I do with the team itself.
So it really does take a team to do this and to do this right. I appreciate being able to speak with you.